medicine physician, Dr. Durrani. Doctor, thank you for being here. You've heard Vaughn talk about why this is happening right now. But put it in your own opinion. How worried should vaccinated Americans be about where things are right now?
Well, good morning. I think they should be cautious, right? I think the Delta variant is a game changer, and we've, not really adjusted to that reality that this virus that we're dealing with isn't the same virus that we were dealing with a year ago or even 6 months ago. And so I think we need to really kind of take a step back and assess the risks that we're taking. We really, truly don't have the full data on what the breakthrough infection rates are, whether you can spread asymptomatic spread if you're completely vaccinated, and then how the vaccine, the Delta variant, and your immune system reacts if you're immunocompromised or you're on chemotherapy or things like that. And so I think having that mask discussion again and really bringing masks back into our lives is the safe option, the right option, until we get the full data and we get more of our population vaccinated.
And break it down for us, because you know this. Are breakthrough patients experiencing the same severity of symptoms that non-vaccinated patients would experience, or can they?
So generally, 99.9% of the cases, they are not. It is a very mild illness or it is an asymptomatic illness. That being said, there are no absolutes, and you can end up in the ICU. A fraction of 1% who are vaccinated who still test positive can end up in the ICU. And that's why I don't think we can make blanket statements about this is a pandemic of the unvaccinated. Even if you are vaccinated, things happening around us in the community will affect us, and we need to really be cautious about that and not turn our radars off, even if you have been vaccinated.
Doctor, you're there in Texas, and you're in East Texas, and where you say things appear to be heading in the wrong direction. How so?
Yeah, so, I think back to 2 months ago when I would go into a shift in the emergency department and I would see none or maybe 1 or 2 patients with COVID. I went into a shift yesterday and about half my patients tested positive or were COVID-related complaints, and many of them tested positive for COVID-19. We're also seeing a much younger population, so in that 30 to 60 range, that have fewer comorbidities but end up needing oxygen and end up needing admission to the hospital. I'm seeing something that I really wished I hadn't seen before, and now I'm seeing again, which is emergency department boarding. We're admitting so many patients for COVID-19 related complaints and then other complaints as well, that the patients are sitting in the emergency departments for a long period of time, 20 hours plus. And that, studies have shown is detrimental to the health of patients. We're having to transfer patients out 4, 5, 6 hours to other cities, especially if you're in a rural area where your hospitals don't have that much of a capacity. So I'm seeing a lot of the things I was seeing a year ago. I truly hope that we can get a handle on this and that they don't continue to escalate.
And so many people thinking that it is going to escalate. I'm curious, I know you're not a public official necessarily, but what should be done to try to convince people? We've done so much. You've had Republicans and Democrats who have gotten out there and said, yes, please get the vaccine. You've had different songs. You've had Vax That Thing Up. You've had athletes that have come out to talk about it. So many people saying that you need to get the vaccine. What needs to happen in order to convince that 45%? I remember back in the 80s, you used to have those campaigns talking about people who were suffering from lung cancer because of smoking. Do we need some sort of PSA like that?
It won't hurt. I think we can do a few things. I'm seeing some leaders in Florida and other states that, a few months ago weren't pro-vaccine that are talking about vaccines in a positive way. I think that's a start. I also think we've had a great national campaign about vaccinations, but not a great transition to a local campaign. And so we really need state and local governments to reach out to primary care physicians that are very trusted by patients and figure out ways that they can get their patients, have those discussions and get them linked in to get vaccines. I think that's going to play a huge part as well.
Yeah, that's a really
all in all, I think. Yeah. And I think if you are vaccinated and you were previously hesitant, you need to talk about that. We need to encourage people to talk about that and share what concerns they had, how those concerns were alleviated, and why they ended up getting a vaccine. So we need those people to talk up as well.